sorry. I know. You know, the women. You know.
Welcome to the Advancing the Kingdom podcast. We're streaming live on all social media platforms and podcast streaming channels. Get ready for a revelatory teaching from our apostle, Matthew Tillery.
Well, greetings. Thank you so much for tuning in to the Advancing the Kingdom podcast. I am your host tonight, Matt Tillery. Listen, we really appreciate you tonight. I'm excited tonight, just really excited about all the things that's happening. Not so much excited about some of these things that are happening, but I am excited to have my guest on tonight, keeping it real with none other than Dr. Denise Gooch, radiation oncologist. Thank you so much for coming on. Keeping it real with Dr. Gooch. We really appreciate you and your expertise and all the information. You have a plethora of information that you give us, and we're very grateful. I know a lot of men have been tremendously blessed by the information that you've given them. As a matter of fact, I know a couple of guys, I believe their lives were saved because of this podcast. So we certainly appreciate you tonight.
Thank you for those comments. It is a thrill and an honor for me to be here to spread this information and to share all of the important information, especially with our audience, so they know what they can do to improve their health and to extend their lives. So I'm honored to be here, to be able to have this opportunity. I'm very happy to be here.
Great. So before we get into the conversation, but I guess we're already in it, but we always ask this question because it's very relevant, it's very important. And I usually ask this question at the beginning of each podcast, particularly when you're up here. Mm-hmm. And the question is, why is it so important for screening, particularly with African-American men? Why is it so important for us to get screened?
Well, the main reason it's important, as you said, I'm a radiation oncologist, so I treat people with cancer. Unfortunately, and sometimes men ask me, why did they get diagnosed with cancer? Prostate cancer is the number one diagnosed cancer in men. So it's not that you did anything wrong, you ate too much red meat for too many years. It is the number one diagnosed cancer in men. And unfortunately, African American men have the highest incidence of prostate cancer in the world. Actually, African men, Caribbean men, and African American men have the highest incidence. And sometimes when I give talks and you may read some information, they may say 1 out of every 8 men will be diagnosed with prostate cancer. Unfortunately, when it comes to African American men, it's 1 out of every 6.
Wow.
Actually a higher incidence. So that's why the screening is so important, because anyone who's ever heard me speak, they will hear me say that it has the highest incidence, unfortunately, for African American men. But it has the highest cure rate of all cancers that we treat. It has a 99%, I always emphasize that, 5-year survival if it is that's why screening is so important.
Right.
If it is diagnosed early and treated, I know sometimes people want to do active surveillance, and that's a whole nother conversation.
Right.
To me, if you are going to have a 99% 5-year survival of any type of cancer, there's no other type of cancer that I treat that has that higher survival rate.
Wow.
So that's why screening, which basically means you are getting tested or you're being evaluated, you're being worked up before you have symptoms. Unfortunately, by the time you have symptoms, usually it's more advanced. So with that higher risk factor and that higher cure rate, to me, that's a no-brainer. That's something that every man should make it their business to get screened for it.
Yeah, you're right. It's definitely a no-brainer. So if you know if you have you could get screened, get checked, and have the opportunity to
Yeah.
live a lot longer life, that's worth it.
Absolutely.
Yeah.
It it just, as a radiation oncologist, it sometimes it pulls at me, because that's something else that sometimes some of the people, their primary care doctor, someone may tell them to wait until the age of 50, but that's actually not what's recommended by the American Urologic Association, as well as ASTRO, the American Society of Therapeutic Radiation Oncology. Our recommendations, as well as the American Cancer Society, is that men who are at higher risk, i.e. African American men, by definition are considered high risk, should start screenings at age 45. They should not wait until age 50. And if there's any family history, quote unquote, first degree relatives, brothers, fathers, someone like that, the screening needs to get started at age 40.
Wow. Well, yeah, and I've had conversations with a lot of men about prostate cancer, and the question I'll always ask: when is the last time you had your PSA checked? And they may say, what is the PSA? Or they may say, I never had a PSA check.
And it's a
So,
blood test. Yes, I'm sorry.
yeah.
Please go ahead.
Oh, no, I was just saying, and that's I guess that's why too that we're so vulnerable, because we don't get checked.
Right. And it's a blood test. Men, I tell people this all the time, men are very fortunate that they actually have a blood test that is very sensitive and that will give you a lot of information about their health. Women don't have that kind of test. There's a lot of different tests we can take, or you can be screened for, but we don't have a blood test that is actually specific for a part of our body. PSA stands for prostatic specific antigen. So it's only made in the prostate, and only men have prostates.
Wow.
So men are fortunate that they have that kind of blood test that can be, in terms of potential initial screening, follow up. As you said, if you had it, when was the last time you had it? When did you follow up with it? And you need to know your numbers, just like people know their blood sugar numbers or their cholesterol numbers. You need to know what your PSA level is. If your doctor says, oh, that's okay. No, you need to know what that okay is. Not just it's okay. You need to know what that exact number is, and to follow it and to track it.
Right. Yeah, because you're right. Because I once again, I've had a lot of conversations about prostate cancer over the last couple of years, and one of the things that I hear a lot is that my doctor, my PSA was a 5 or a 6, and my doctor just said, we don't worry about it. We'll check it next year, or 2 years from now, whatever.
Exactly, and unfortunately, by then it may have doubled or even tripled by then. Right. And that's something else. Someone actually asked me once that what is the range, quote unquote, of normal, the 0 to 4 nanograms per milliliters. That is a general guideline, but you have to remember, when they come up with any guidelines or whatever numbers are, like your normal blood sugar, your normal cholesterol, that's maybe, a couple hundred people. They may not look like you. So 4 may be an upper range of normal for an African American man, because they actually have proven that for men, there are actually some men that they can have a level of 2.5. As a matter of fact, some of the urologists think that for African American men, anything above 2.5 needs to be worked up. Because at least 15% of men, if they undergo prostate biopsies with a PSA of 2.5, will actually be found to have prostate cancer.
Wow. So are there any symptoms, are there any symptoms, I guess, if you just, what's happening in the body? Will you know that you have prostate cancer?
No, that's really one of the problems. By the time a man has symptoms of prostate cancer, usually it's more advanced. The other thing that you need to remember, and most men, if not all men, know this, as a man gets older, a man can be diagnosed with something called BPH, benign prostatic hypertrophy. And oftentimes men have had this conversation with their doctors, and what happens is what they call, you get up at night a lot. You're getting up 3 times at night. You're having problems holding your urine. So that whole urinary symptom is oftentimes one of the first things that cause a man to go to the doctor for evaluation. And the thing is, yes, most men will get some BPH. Basically, what happens, the anatomy, the bladder, of course, everybody know where the bladder is. The prostate's right there at the base of the bladder. And over time, as a man ages, the prostate can enlarge, benign prostatic hypertrophy, or it gets a little larger. And basically, the urethra, which is draining from the bladder, gets kind of constricted by this prostate that's getting a little larger over time. So that's why men can have urinary symptoms. The
Wow.
thing about it is you can have that with prostate cancer too. So you can have benign prostatic hypertrophy, or you can have a process that's actually starting to be prostate cancer. You don't know it, and your doctor, no offense to your doctor, but they're assuming that it's a benign process when actually something else may be going on. That's why, as I said, men are fortunate that you have a blood test.
Right.
So that's why if your doctor, and unfortunately I've had men in their 60s or somewhat, and they've never even had a PSA. If any man who's really over the age of 45, but definitely over the age of 50, if your doctor doesn't recommend getting a PSA, request it. Just say,
Right.
hey doc, how about checking my PSA? They're not going to say no.
Right.
Hopefully they should have already done it, but just request it. Just say, can we, next time I go to the doctor, get a physical, can you check my PSA level?
Right. Right. Yeah, and when I was getting treatment in Hampton, it wasn't that many, but it was a couple of guys that was actually in their 30s. So
Yeah.
so that's wow, that was pretty interesting.
It's
So
rare, but like you said, unfortunately, you do get some younger men, especially nowadays. I'm seeing younger and younger men. Like I said, mainly in their early 40s. I'm not sure if I've seen a 30 something year old, but I've seen a few under early 40s, 41, 42. Yeah.
yeah, so does having an enlarged prostate does that increases the risk for prostate cancer?
No, it's like I said, it's a quote unquote normal process. Every man eventually is going to have his prostate just get larger over time. So that doesn't mean a man has prostate cancer, or because he starts having urinary symptoms that he has prostate cancer. There are actually kind of two processes that may be going on in conjunction with each other, unfortunately. So a man
Right.
can have a large prostate and not have prostate cancer.
Right. Right.
So, yeah, so it doesn't mean he has prostate cancer just because his prostate is enlarged.
Right. So you treat all types of cancer. What are the different treatments for prostate cancer, and is there one treatment, I guess, that's better than another treatment?
Well, you're right. There's a lot of different treatments for prostate cancer. I'm a radiation oncologist, but when you talk about just general, there's kind of not a smorgasbord, but there are different options that men have if a man is diagnosed with prostate cancer. We talked about the active surveillance, which I'm not a fan of. So if we're talking about treatment, okay, the one treatment that pretty much everyone's heard about is surgery. There's pros and cons of that. Then we do the radiation. There's pros and cons. There's what we call the traditional radiation, which is what I do, which are called photons. It's just something that we do, like targeted radiation beams. And there's protons, which you had the honor of getting. And the difference is what we use with photons, it actually is a good way to treat the prostate, and kind of, especially if you have regional areas that we need to treat, things like that. The protons are very targeted. Those are charged particles that actually hit an area that we want to treat, which is very good and very effective. But sometimes if you need to treat a larger area, it may not be able to get, kind of a larger circumference as we can get when we use with photons.
Right.
And then you may talk to a man who's gotten what they call the internal seeds, the brachytherapy. That's another treatment option that a man could get. And basically, those are usually the most common types. Now, the other thing I need to tell you, sometimes people ask me, what about CyberKnife, things like that? The only difference in CyberKnife, it's still a linear accelerator, but it's a robot. And basically, it's a rotating head of a robot that still kind of shoots targeted X-ray beams to a target. Now, there's nothing wrong with CyberKnife, and just like there's a good reason to do all of that. But what I recommend for men who have more early stage disease, if it's, everything in when it comes to cancer is staged. So
Right.
if a man has early stage disease, he doesn't have any risk of it spreading to what we call the seminal vesicles, or the vesicles that kind of drain into the prostate, or any of the regional nodes, that any of those treatment options I just mentioned are fine. But if there's any risk of it spreading to the nose, or if it looks like what they call extracapsular, the prostate's within a capsule. So if it's outside of that capsule, or spread to that capsule, and or involving the seminal vesicles, as I just said, then I recommend the external beam. Uh, what we have, the photons, because we can kind of cover a larger area and
Right.
get that dose to some of the regional areas that need to be covered.
Right. Wow. Yeah. So there's a question, I guess, and I think this is a lot of guys have this question, and I'm assuming, and I guess this is one of the reasons why sometimes men don't get checked for prostate, because they think they will lose their sexual function.
Mm-hmm.
So, and I know you talked about doing some things prior, with the treatment. Talk about that for a few moments.
Right. I think it's very important for that to be a conversation that every man should have before he gets any type of treatment. Because as you said, just for me, from taking care of men for years and things like that, I know that's one of the main reasons men don't want to get screened, because they don't want to have to deal with it. They definitely don't want to undergo treatment. So what my recommendation is, and for every man that I treat anywhere in the pelvis, whether it's for prostate cancer, colorectal cancer, or anything like that, I always start them on Cialis. All right. Now, there's actually some studies that actually support using these drugs, these medications. What they do, they improve the blood flow to the penis. And because radiation by itself, no matter what kind of radiation you use, can cause scarring and fibrosis, which of course would impact a man's ability to get an erection. But they've actually even shown that these medications, it can help a man if he's going to have surgery.
Right.
Because unfortunately, one of the main toxicity side effects, even though the urologist may not tell you that, and there's all this nerve sparing radical prostatectomy, at least 40 to maybe even 50% of men usually are impotent after surgery, and only a small percentage get that back. So
Wow.
I actually was talking to a urologist about this about a month ago,
Wow.
that if a man starts on this, one study just looked at Viagra, but like I said, I prefer Cialis. I think, it's long acting, things like that. If they start that before they actually undergo surgery, continue it, they don't have the toxicity, they don't have the erectile dysfunction. And I can tell you from many years of treating men that even if a man is functional and potent, that it keeps them potent so they don't have those problems with erectile dysfunction.
Right. Yeah, and I think that's, like we said earlier, I think that's a big reason that a lot of men don't want to get their prostate dealt with. But once again, if you die, you're not going to be able to have sex anyway, right?
Well, that's true.
I mean, that's a very harsh statement, but it's a reality. So that's why, men, you need to get checked. If somebody asked a question, well, why are you always talking about prostate cancer? Well, Noah preached it was going to rain for a long period of time. So I think because of my experience and what I went through, I want to sound the alarm, right? And I think sometimes our trials and some of the things that we go through, a lot of times is to benefit somebody else. So I have this platform now, and you have so graciously come on each month to share. So, and I think we've got the news out. A lot of men have been blessed, and once again, I believe lives have been saved because of this podcast. So I want to continue to spread the word. I mean, we keep spreading it, and sooner or later, even if one or two people get their, they save their life. So their family needs them.
Exactly. And I tell men that it's so important that, as you said, to undergo the screening. If you get the diagnosis, as you said, we can discuss the various treatment options. But if you're diagnosed early, you get screened, you get treated, you will continue to live your life. Prostate cancer will not take you out of here. It is the number one diagnosed cancer in men. It's the number two cause of death. Okay,
Wow.
this is something that even when I've actually gone to meetings with other doctors and everyone's talking, that's why I'm not a fan of active surveillance. So, and people will talk about all these things, and I'll raise my hand, and they're like, "Yeah, well, if any man lives long enough, he's gonna get prostate cancer." Half of them. So I go, "No, no, no, that doesn't apply to our African American men. It's the number one diagnosed cancer, and it's the number two cause of death, and has been the number two cause of death for like the last 50 years.
Wow.
So that's why it's so important to undergo the screening. You can get the medication, you can get the pre-op, whatever evaluation. As I said, I start all men that I treat unless there's a contraindication on Cialis. I'll tell you the dosage. That sometimes we've gone through this. The 5 milligram dosage your insurance company will usually pay for. The 10 milligrams they may not, but just put in a pitch for Hims. Apparently, Hims you can get it through Hims, and it's actually the same. It's just compounded pharmacy. They can actually get the formulation for you. But if that's what your only hesitancy, then I need you to go ahead and move forward with this because, as I said, it is the number two cause of death.
Wow.
So lung cancer is number one, prostate cancer is number two.
Wow. You know, that's alarming that it's that high rated when we have opportunities to get screened and really get a good handle on this thing while it's still confined to the prostate.
Exactly. I mean, we're talking cure. That's what I tell. It has the highest cure rate.
Wow.
There is no other cancer that I treat. I treat colorectal. I treat breast. I treat pancreatic. I treat brain cancer. I treat lung cancer. This has the highest cure rate of all of them. None of them, if you look at a graph, the prostate cancer cure rate's here. Everybody else is about here. It's not even
Wow.
close.
Wow.
It's like 20 percentage points above every other type of cancer
Wow.
in
Wow.
terms of cure rate.
Well, listen, guys. I'm with Dr. Denise Gooch, radiation oncologist tonight, and she's going to be in Rocky Mount this year. Rocky Mount, NC. She will be here live and in living color. So we're excited for her to come to Rocky Mount, and really it's going to be some great conversations. And we're going to do a live podcast, maybe two, while she's here. So it's going to be a great time. So we really appreciate you coming to Rocky Mount to really share a plethora of information on prostate cancer.
Thank you so much. It's an honor to be able to have these conversations. As you said, I give a lot of talks. I speak to a lot of groups and things like that because it hurts me. I mean, our men are dying of something that we can cure. I mean,
Wow.
to me, the logistics of that doesn't make sense.
Right.
I mean,
Right.
our men are dying. It's the
Right.
number two cause of death. As you said, your audience, I guarantee you that people in your audience who are listening to this know of someone, know of a family member, know of a friend, a colleague, coworker, somebody that has died of prostate cancer.
Right. Right. Yeah.
That did not have to happen. And I actually was giving a talk. I was in Atlanta and just giving a general talk. And as you were saying, that we know, it's not a theory, we know that the number one reason that men don't want to be screened for prostate cancer is that they're worried about the risk of erectile dysfunction. They make comments about, oh, they don't want the digital rectal exam. I said, no, that's an excuse because
Right.
they can get their doctors to back off from them and leave them alone, then they don't have to deal with the issue of the prostate of the erectile dysfunction from the treatment for prostate cancer. And the main person who was sponsoring it, her father died of prostate cancer. She could never figure out why her father would not get treatment and would not get. But once I said, because men don't want to have the risk of erectile dysfunction, I just literally saw the color leave her face. So
Wow.
that
Wow.
possibility had never occurred to her. And I looked at her and she was just like, it's like, I lost, like you said, your family needs you. I lost my dear beloved. She actually had a pin that she wore on her lapel all the time of her father.
Wow.
So she lost her precious, invaluable, unreplaceable father because he didn't want to have erectile dysfunction.
Wow. Wow. Listen, man, it's very important that you get checked. Once again, your family, your wife, daughters,
Yeah.
mom, your family needs you. So make sure you're getting checked, getting screened. And if you do, we had a guy text me. Actually, he called me because I did a podcast with my testimony podcast, and I actually left my phone number on that podcast. I didn't realize that, but he called me and he said that he just been diagnosed with prostate cancer. Probably the day prior to him calling me, and he said I was on YouTube and I was just searching for information about prostate cancer, and your podcast came up, and it was a woman up there. I think her name was Dr. Gooch, he said. And she was talking about prostate cancer. And this guy ended up, he called me actually, and we have been having conversations since then, and we've been talking back and forth. And, so it's just stuff like that. You just never know who you're reaching. So we definitely want to continue this because, maybe that podcast may have been a reason, because he said he had decided, or he was thinking about not doing anything. But then when he watched that podcast, he started, I told him and started to encourage him, you don't need to not do anything. You need to do something. And so long story short, he ended up getting treatment for it.
And that's important because you can still maintain your quality of life. I mean, just to keep it real, what makes you a man, just to be very honest, is not basically dependent on your sexual function. I mean, let's just kind of put that out there. But if that's a critical part, we understand how men feel, you can still maintain that. So don't make that the reason you don't get diagnosed or you don't get screened, and definitely don't make that the reason you don't get treated.
Right. Wow. Well, time goes quick and fast on this podcast. But listen, is there anything else tonight that you want to share about prostate cancer? Are there any, are you familiar or hearing of any new treatment or anything like that coming out in terms of prostate cancer?
It's funny you should mention that. Well, not so much that I heard about a new treatment that, as you said, most of our treatments are very effective, but I did hear about something that we just did a health fair here in Maryland about a month ago. And it was interesting because we had quite a few specialists on there. And one of the specialists that I spoke to, well, we were standing around and talking and discussing things with people. And one of the people who was talking about something called trimix, but I didn't know what he was talking about.
Right.
And so then he was talking with the urologist and they were going back and forth. And then finally I asked him, I said, what is he talking about? And he told me, and I actually looked it up, that it's apparently, like, someone even asked me, you hear these commercials, they say if you come into this doctor's office who specializes in erections and erectile dysfunction, that within 10 minutes of being there, they can almost guarantee you'll have an erection. And they go, what are they doing? I told them, I'm not really sure what they're doing. But I know. But when I looked up this trimix, apparently it is.
You said it's called what? What is it called again?
Trimix. Trimix.
Okay.
Apparently it's an injectable medication that's used to treat erectile dysfunction usually when the oral pills and the medications have failed. Okay. Right. So this was kind of new information. I knew about it, but I didn't know it actually had a brand name.
Right. Right.
And so what they do is the man injects it. Apparently it's a very small needle. He injects it into the side of his penis, and it acts directly on the blood vessels to induce erections within 5 to 10 minutes. So that's what I'm thinking must be what they're using in the doctor's office when you go in there. And it has a mixture of 3 drugs, prostatil, piperine, and phenethylamine. It requires a prescription, and apparently those doctors' offices have it. But it also, basically these 3 medications, one relaxes the smooth muscle, the phenethylamine blocks the receptors to increase the blood flow, and alprazotil widens the blood vessels. So it's kind of a 3-drug medication that works to help men get and sustain erections. Like I said, it's injected directly into the side of the penis. And it says it's highly effective for men who don't respond to the pills, but they do have to refrigerate it, but because it has a limited shelf life. I really looked it up. And the most common side effects are a little pain and discomfort and a little bruising in the injection site. But
So you have to inject it each time, or
that's the impression I got, that you have to inject it every time. But I heard the needle is very small.
gotcha.
Of course, men don't like the idea of needles near, their male, but apparently it's very effective. Like you said, they say it's effective, highly effective, according to the information I read.
Right.
That especially for men who don't respond to the usual oral pills. The main side effect, though, and the other doctor had mentioned it, there is a risk of priapism, which some people may or may not know what that means. PRIAPISM, basically
Yeah.
a sustained erection that lasts more than 4 hours. So that is a potential side effect, but that kind of gives you an idea how effective it must be. So,
There may be some guys want that.
I know, but it's dangerous because
I'm just kidding.
it's dangerous because what can happen is, the whole thing of blood flow, it has to be oxygenated. And then if it's in there because it's being trapped in there because there's a sphincter to keep so it doesn't run back out.
Right.
And if you don't have oxygenated blood in there, you could lose your important man part. So yeah, that's why it's dangerous.
Yeah, but also some of those pills, some of the pills, they lower the blood pressure as well. Does it? Is that correct?
It is. As we tell men, you only have a limited amount of blood. There is no special blood that comes from somewhere else to go to theirs. So
Right.
that's why you have to, men who are on nitrates, they don't recommend men who are on nitrates because that's a vasodilator too.
Right.
So this is also a vasodilator. So that's what it's dilating the blood vessels to quote unquote target the penis. And men who have a history of heart disease, because they need that blood flow. So you don't want to be kind of depriving, or as a lot of mothers used to say, when you have blood flow to one head, the blood flow isn't working in the other head, kind of the way.
Right.
So
Yeah.
it's important that if you have a history of heart disease, or like you said, low blood pressure or something like that, or you're on nitrates, that maybe you don't want to take those pills, those oral pills, because they are vasodilators.
Right.
The good thing, since you mentioned that about this injectable, it's a direct injection, so it's not going to be a systemic effect. It's just going to be a direct effect. So
Gotcha.
that would actually probably be preferable.
Yeah. So okay, gotcha.
Mm-hmm.
Wow, powerful conversation tonight. Listen, I'm here with Dr. Denise Gooch. Very, very powerful conversation on tonight. Our time has certainly come to an end, but just really grateful to have you once again on the podcast, and just really appreciate you. I know you're still at work, so we want to go ahead and don't want to hold you all night. So
That's okay.
yeah, just really appreciate you, and thank you so much for coming on the podcast each month, just sharing a plethora of information and a lot of good stuff to us. So just really, once again, very grateful for you.
Thank you. It's an honor and a privilege, as I said, to be here, because anything that I can do to help our men live and thrive and live your best life, that is actually, as you said, that's my ministry. That is my ministry.
Right.
So I take care of all kinds of cancers, but that is the one closest to my heart.
And you certainly do a great job with your ministry. So I just want you to share that with you.
Thank you.
Yeah, so really appreciate you. Anything else you want to share before we end it tonight?
No, that's all. That's all. Just if you care, I know you care about your health. I know you care about your family and things like that. Really, really give some thought. If you haven't had your PSA check, like I said, it's a blood test. Have that done. As you said, your family needs you, your wife needs you, your children need you. And I have seen more adults that are traumatized because like their father or whatever, quote unquote, died at a young age, or just that's something that you don't want to burden your family with. Okay.
Right.
So this is something that we can diagnose, we can treat, and we can cure.
Wow.
I can't use that with too many other types of cancers that I treat.
Wow.
That's not a term I can use.
Wow. Well, powerful stuff. Listen, I am Matt Tillery here with Dr. Denise Gooch on Keeping It Real with Dr. Gooch. Listen, been a great podcast talking about prostate cancer. Listen, man, once again, go get checked, go get screened. Make sure you're getting your PSA check. We want you around. Your family wants you around. We want you to live a long life and be in good health. Listen, I am Matt Tillery. Until next Monday night at 7 p.m. Go and advance the kingdom.
We pray you have been empowered and blessed by this teaching. Join us next week for the Advancing the Kingdom podcast. If you would like to reach us, email us at mltillery@icloud.com.